Good morning, everybody. Hope you're well. It is 9 a.m. on this Friday, January 12th. Thank you so much for joining us today. We are thrilled to have everybody on the call. I know some of you are still joining us. Welcome to our weekly call. We're going to get started without further ado. So our agenda today, we're going to run through our usual welcome and our AMA updates. We're going to talk a little bit about retention and OEP planning today. So some of this stuff we have touched on a little bit over the last week or so, but I wanted to delve a little bit into Q1, some of the opportunities around the open enrollment period for Medicare Advantage, and also planning and retention as well. It's a good time to start looking at those parts of your business. So we're going to look into that. We've got Judy Daniels on the line as well. She's going to be going through her corner, and she's got a couple of things to share on the call as well. As ever, we have all of our panelists on. We have myself, we have Judy, also, we have Lisa and Diane and Richard, so please feel free to ask them questions. And again, we have our chat box. So if you want to put any comments, please go into the chat and you'll be able to see all the comments from everyone else as well. If you've got any questions for our panelists, please put them in the Q&A. That way we can make sure we keep those separate and we can answer those questions as well. So let's get started. Okay, so as I mentioned, OEP, we're going to be talking about your planning, activities, that type of thing as well. So we're going to get onto that a little bit later on. AEP commissions, we have started to see some of the carriers pay those commissions. I believe WellCare and Humana paid yesterday or the day before, if I was rightly informed there. And of course, United and Aetna paid last week as well. So watch out for those commissions as well. Just to let you know, we are yet to get paid any overrides. So if you're a GA waiting for those, we have not been paid any overrides for AEP as of yet. Apart from some of those direct carriers, so Aetna and United Healthcare, you would have been paid your overrides directly into your accounts as well. Training calendar, we're working on that. It's going to be available next week. It's been a bit delayed. We're trying to put together a robust plan for Q1. So please bear with me and our team on our training calendar as well. I've been seeing lots of questions from agents around their clients for their new plans. And, in particular, what I've seen is a number of clients are asking you guys, I've got this new drug plan and my drugs are costing me a little more this year. What's going on, et cetera, et cetera. So don't forget, when you are enrolling somebody into a new plan, make sure you are giving them an estimate on their drug costs as well. Don't forget, a number of the drug plans include deductibles. So again, January quite often is that month where it includes the cost or partial cost of a deductible. So quite often these drug plans are a little bit higher in cost in the first couple of months of the year. So please be sure to communicate that with your clients as well. Don't forget as well, using the Medicare Center is going to allow you to retain that information. So if you have put their drugs or you've calculated the drug cost as part of your needs analysis or needs assessment, by doing it in the Medicare Center is allowing you, again, to retain that information, and you can send that out to the client. Don't forget, Medicare.gov does not retain that information for you. So if a client's circling back with you and asking you that question, you're going to be able to provide that information directly from the Medicare Center. Okay, still got a ton of opportunities with kiosks coming up, particularly in Nevada, where we've still got, I think, some hours available at our Walmart kiosks. We've also got a few Smith's opportunities, Smith store, that's Kroger in Nevada. And again, if you're in California or other states, We've still got some opportunities at CVS and Walgreens as well. It's a really good opportunity to maybe do 1 day a week where you're going to get in front of those potential clients as well. Sometimes this could be that lifeblood of your business. I know even some of our most experienced and successful agents do a CVS or a kiosk once per week, even if it's for a few hours. I'm a great believer in doing these type of events because it gets you directly in front of Medicare eligibles, and for sure it's going to be that additional opportunity as well for enrollments. Okay, we are still seeing that clients are in those counties that had some disruption during AEP. Some of these folks are still not moved plans. We've been doing enrollments all this week in some of those counties. We are getting questions into our office about some of the plans that have left the county or some of the providers that have moved on, etc. So some of these folks that are in those counties that had disruption are still needing your help. So maybe that's an opportunity for you in Q1 where you can help some of these folks, whether that's sending out a flyer, postcard, or really just being available at your local doctor's office or medical group. You have some opportunity here to really help those folks as well. Final thing, carrier trainings, they are starting up. You're probably seeing there's a ton of virtual, but also in-person trainings as well. This is an opportunity for you to get in front of those carriers, particularly if you're fairly new. And again, it's an opportunity for you to get not only, get accustomed to these type of events, but also meet and greet those broker managers. And for those of you that have been in this business a long time, as you know, the squeaky wheel gets the grease. So if you are attending a number of these events, chatting to those agent manager, broker managers, then you may get some opportunities that you wouldn't previously have had. So please continue to look out for some of these events, particularly those carriers that you are focusing on as well. Okay, so let's talk a little bit about OEP. Bit of an overview. What can you do? Obviously, OEP is the open enrollment period, MA open enrollment period, in fact. So Medicare Advantage open enrollment period. It runs until March 31st. It started January the 1st. And again, if a person is already on a MA or MAPD plan as of January the 1st, they can make a one-time switch or change to another Medicare Advantage plan, or they can go back to original Medicare and a standalone prescription drug plan. This does not give them necessarily a guaranteed issue for Medicare supplement, however, so you must make sure that they may qualify through underwriting or other means, or simply they're going back to their Medicare supplement plan if they are using that one-time change as well. You cannot advertise open enrollment periods. You cannot say to folks things like, yeah, there's an enrollment period where you can make a one-time switch. You cannot talk about open enrollment, but you can advertise special enrollment periods. And as you have seen, a couple of our carriers are continuing with the weather-related special enrollment period in California. You've also got the initial election period as well for those folks that are turning 65. And of course, January 1st started the special election period for those folks that are either dual eligible, which means they have Medicare and Medicaid, or they are LIS eligible as well. People turning 65, of course, moving to a different county, dropping out of an employer group health plan. These are the type of folks that do qualify for that special election period. So that is what the open enrollment period is about. I know most of you know this, just want to cover that as well. So what should you be doing this time of year? Well, if you haven't already, this is a great time to create a business plan for Q1. We have a business planning form. It should be on our AMA portal. If not, it's on the Berwick portal as well. It's an opportunity to write down your goals, calculate how many enrollments you would like or you need to hit those goals. And again, the areas to market in, and also the activities you're going to do. It's all very well saying you want to hit 30 enrollments a month or however many you would like to hit over the next 3 months, but you're going to need to do some activities during that time. And also, of course, that very important marketing or advertising during that time as well. And of course, what supplies, sales materials you will need to achieve those goals as well. So activities, what type of activities could you do this time of year? Well, of course, there's sales meetings or sales events. These are generally run by the carrier. So of course, if you're doing a formal or informal sales event, they will need to be reported as well. If you're not sure how to report it, reach out to the carrier that you are participating with. Again, if you have not or you've never done a sales event or sales meeting and you would like to do that, then this is the time to start talking to your carrier partners. And again, a nice way to do that is to, go to their trainings, turn up to their in-person events, and, become an advocate for that plan. That's what our carriers are looking for. They are looking for us to be those advocates and those cheerleaders for those plans, because of course they can't get that message out there in the community without utilizing us as brokers or agents there as well. Good time of year to do educational meetings. I know some of you have done meetings at restaurants and been part of a few different programs with our carrier partners as well, or medical group partners. This is a great opportunity to do that or continue doing that. Don't forget, if any of these are being sponsored by the carrier, medical group, or AMA, you do need to provide feedback, and you do need to provide how many leads and how many enrollments you have achieved during these meetings as well. It's also a great time to send out either thank you cards or some type of communication in Q1. Don't forget, you can ask for referrals. Just send a thank you card out, just saying thank you so much for your business. I really appreciate it. If you know somebody else that is turning 65 or somebody that may need my help, please have them reach out to me. So again, you don't have to talk about OEP, but you can just say, hey, if somebody needs my help, please have them reach out to me and I can help them. Don't forget to get some of these activities advertised. You're going to need to do your own flyer distribution. Yes, indeed. No matter what support you're getting from that carrier partner or that medical group, you should also be doing your own marketing piece as well. This is mailing either through our mail process or by foot. Yes, absolutely. Flyer distribution, as we say, boots on the ground is a great way to support any type of marketing that is happening in your local area. Some tips to actually distribute these flyers. Don't forget places like Starbucks. They have a notice board, and quite often on that notice or bulletin board, they have information or events. Wouldn't this be great if you could have a flyer advertising your events here as well? Don't forget places like hairdressers, gyms, that type of places, churches, senior centers. All of these are great places to advertise your events, particularly if it's an educational event. Go in, explain you're actually there to help seniors understand how Medicare works. And you would like to know whether you could just leave a flyer behind for them to show people as well. I mentioned before kiosks. This time of year, a ton of health fairs are happening as well, community events. So things like food banks, churches, etc., are great places to go and advertise or go and do your events at. And this time of year, you've got many choices of the type of event you're going to be doing. T65, yes, that stands for turning 65. So if you have any folks that are turning 65, this is a really good time to do that. Dual eligible, so DSNP type of plans. So those that are on Medicaid and Medicare, this is a great time to talk to them. Had an example yesterday that we were in a healthcare location in a clinic, and a client came in and had been moved to a different plan, and they were like, look, I've been moved to this plan. Why would I like to, have a review done with you? And quite honestly, the reason is the plan they were put on didn't have that doctor in network at the clinic. They still wanted to come to that clinic and they wouldn't have been able to. So some simple information like that can really help the client, but also help you grow your book of business as well. These are some of the things that are happening as we speak. Okay. What else? Client retention. So we talk about new business. This is a great time of year to retain your clients. I've spoken to a number of you already this year. Some of you have had great success in retaining your book of business or retain the majority of your book of business. So we already mentioned thank you cards. And again, don't forget to put those 5 business cards and your referral ask as well. This is the time you should be making those phone calls to your new clients. So don't forget, you've got a number of new clients from AEP. It's a great time for you to reach out to them over the phone. Yes, over the phone. Talk to them about their new plan. Make sure they've got their ID card. Check that their new primary care physician is correct on their ID card. And also you can talk through them how to use their plan, how to use some of those benefits as well. Advise that client as well to maybe make an appointment if they haven't made an appointment. If you're in Nevada, particularly, there are some of those medical group partners that actually provide incentives for agents to make those appointments with the primary care physician or doctor's office. So, of course, it's a great time to do that. Maybe talk to them about their medications or any issues with it. And, of course, once you're in there as well, make sure that you're talking to them about if they need any referrals to specialists, etc. Maybe remind them to go for their annual physical and remind them to utilize some of their benefits that they may not be using or know how to use as well. Of course, start those birthday cards or phone calls. I know a number of you already send out birthday cards. This is a great opportunity for all of you to really support your clients and just show them that you care. And again, every time you send out a birthday card, you can say, hey, I'm here for you. I know I was talking to one agent yesterday that actually when they've enrolled a client, they send out a thank you card and send out a fridge magnet. Yes, a little magnet with their details on, and that person's actually received, I think, 3 referrals over the last month just from those fridge magnets. These are pretty inexpensive for you to get hold of. And of course, 1 referral is going to make that money back for you as well. Don't forget, this is the time of year where you can talk to them about some of the other things that you offer. So if you offer things like final expense or life insurance, talk to your client. Just say, look, just want to ask you as well whether you have taken care of any opportunity around final expense. You may ask what final expense is, and you can talk to them about the cost of burial plots or funerals. And again, making sure that's not a burden for their family. So these are the type of questions that you can talk to your clients about, and you have the opportunity this time of year to cross-sell. You're not as busy as you were in AEP as well. And also, don't forget, set up an appointment. Just review what they've been doing, review their plan. Some of your clients that you may not have got hold of during AEP may be a great time for you to get hold of them. Set up an appointment again. And don't forget, you can invite any adult children to be there as well, particularly if you're talking about some of those other products that you sell, if you do life insurance or if you do under 65. This is the type of thing that you can start talking to your clients about. So how are you going to do that? As we mentioned, distribute or mail those flyers out. You've got loads of opportunities around this time of year. SEP, lots of special enrollment periods. If somebody has LIS or is eligible for extra help, don't forget that program has changed slightly this year as well. It's been enhanced to up to 150% of the federal poverty level. And there's 2 types. There's under 100, over 100%. So there's not the 4 different levels of LIS that there used to be as well. If somebody is dual eligible, you've got that opportunity for those clients as well. And that's somebody that made a switch in AEP. You've got the opportunity to help them during OEP, but you can't obviously advertise that as well. We've also got a ton of letters. So if you want to mail a letter out, particularly if you're newer in this business or you do have another line of business, we have constructed letters that you can literally send out, put your signature on, or advertise the fact you have another line of business and you would like to help, or you would like to be considered to help those clients. Lots of opportunities to do that as well. Again, if you've got relationships as an agent with any other clients from any other type of insurance, P&C, for example, is a great opportunity this time of year to send out those letters that we have pre-done as well. And of course, conduct those sales or educational meetings. Yes, continue to do that throughout OEP. It's a great time to do that, particularly around those T65s. And if you are comfortable speaking to groups of people, talk to your carrier, talk to the agent manager for the carrier that maybe you sell the most about becoming a presenter. It's normally their decision. You can essentially present any carrier that approves a presentation. But again, if you're going to want that advertised by the carrier, then you're going to need to talk to the carrier to get that authorized as well. Other suggestions for activities, contact your existing clients, try and get those referrals in as well. And of course, CMS allows you to contact existing clients that you have a relationship with as well. And of course, you can talk to them. So if if you do sell another line of business, talk to those existing clients. You can say, oh, by the way, I actually offer Medicare now. Did you know that? And just have that conversation with them as well. That cross marketing is really important. Do you sell group insurance? If you do, or if you do not, maybe you could partner somebody that does. A lot of the folks that sell or offer group health insurance or benefits don't necessarily want to offer Medicare, or they just offer Medicare supplement, and they may not even know how it works properly as well. Don't forget, you can partner with somebody and say to them, look, I'm not going to take away your group business. I'm just here to help those folks that are 65 or older as well. We talk about grassroots marketing quite a bit. This involves things like food banks. Maybe you can offer to volunteer help at our local food banks, community centers, or senior centers. And of course, by doing that, you're going to get in front of seniors. And if they ask you what you do, you can absolutely say, yes, yeah, I offer Medicare. You can't kind of do a pitch on that if you're volunteering, but of course you can answer that question. If somebody says, hey, can I have your business card? Have them on you. Make sure you keep those business cards with you. Visiting other places like doctors' offices or pharmacies, great opportunity to do that this time of year. They're probably seeing a lot of folks during the annual enrollment period, but maybe this time of year they're not seeing many people. But also start with your own doctor. You already have a relationship with your own doctor. So why wouldn't you want to start with somebody that you know already? Again, you can test your script. You can test what that looks like as well, starting with your own doctor. So they're just a few tips really for all of you to focus on during OEP. Yes, you might have heard some of those before, but I just wanted to give you some reminders. Okay, before I go on to our carrier updates, I believe Judy is on the call today, and I think she wants to share some of her updates with you. And I believe I need to make you a presenter because I think you want to share your screen, Judy. Is that right?
Nope, I'm not going to share my screen this morning because I'm driving actually. So that's okay. I'll do it from the screen, Neil. That's not a problem. So good morning, everybody, and Happy New Year again. Great presentation so far, Neil, this morning, and I couldn't have said it better. You are definitely spot on in all of your tips and tricks. And speaking of tips and tricks, this is the general enrollment period for Medicare, everyone. The general enrollment period for Medicare is that period from January 1st to March 31st, where you can enroll somebody, or somebody can enroll in their Medicare if they missed out on it when they originally were able to. So let's say that somebody had a special enrollment period for their Medicare because they worked past 65 and they didn't enroll when they were first able to because they went on COBRA. COBRA, as you know, is not credible coverage. So they could incur a late enrollment penalty for their Medicare if they didn't get their Medicare when they were first eligible to, and a year or more went by. So the general enrollment period is when they definitely need to do this and get that going. In addition, it may be somebody who had their initial enrollment period and neglected to get that done at that time. They thought, oh my goodness, I've got to get my Medicare. Well, this is the time that they can do it. You may also remember that if somebody doesn't have enough quarters to earn free Medicare Part A, they can buy their Medicare Part A. And if they never worked at all or worked up to 30 quarter hours in paying into FICA taxes, then they can buy their Medicare Part A, but it would be $501 per month. Ouch. However, if somebody has Medi-Cal, remember, Medi-Cal will pay, or Medicaid, either one, Medicaid in Nevada and the other states, or Medi-Cal in California, it will pay for Medicare Part B's premiums, but not Part A. So then you have the Medicare Savings Program that can, if they qualify for the QMB status, as we've discussed before, that will pay for their Medicare Part A premium if they have one. But another way that somebody can qualify for free Part A is through their spouse's work history. So if they have their spouse already on Medicare, they can qualify for free Part A based on their spouse's Medicare, work history, I should say. Now, an interesting thing happened this past week. I was asked to help someone apply for their Medicare. And, you know, I love these scenarios to talk about because these are real life situations that I think you'll find very educational. And it kind of took all these things that I was just talking about. It took all of those things to think about during this process, because this lady was self-employed and she had not been paying into her FICA taxes quarterly, which you should do when you're self-employed. And because of that, she only showed 34 quarter hours, and she was going to be turning 65 in April. So she didn't qualify for free Part A. And so she went and called Social Security to apply for her Medicare Part A. First, they had gone, though, to the Social Security office, and it's a smaller one. It's in Oxnard and Ventura County. She'd gone there, and she went late in the afternoon, which that's the first boo-boo she made. You should always go first thing in the morning. But she went later in the afternoon. And once she got up to the window, they said, oh, you're at the wrong window. You need to go to the one to apply for Medicare. And the person who helps people apply for Medicare was not able to see anybody else. And so they were turned away. So she went to call the toll-free number for Social Security. 2-hour wait. And then the call got disconnected in addition to that. So frustrated, you know, she reached out. So I met with her and her husband, and I'm learning all of this. And it turns out that her husband had turned 65 about 3 or 4 months prior and had his Medicare Part A and Part B. And I said, well, let's help you apply for your Medicare online. So we went online to set up her My Social Security account. because you have to do a My Social Security account in order to apply for your Medicare online. There's a series of questions that they ask to identify a person and to ensure security-wise that this is the person that they're enrolling into Medicare. They're very complicated questions, such as back in 2010, you had a mortgage with which of the following companies? And the last one will be none of the above. Well, any of you who have had a mortgage know that sometimes your mortgage gets sold, or you may not remember who a mortgage was with 13, 14 years ago. So it can be very complicated. So just to get to that part of it, though, they ask a couple of questions, and then automatically it pulled up a page that said, you don't qualify for Medicare Part A. Please contact your Social Security office. And, you know, this is the same that you'll hear if you go in person to a Social Security office. If you don't qualify for free Part A, many times they'll tell you, oh, you don't qualify for Part A, but you qualify for Part B. We know that that's not the case because the qualifications are the same for both. However, you just don't qualify for free Part A. So I see that, of course, I told her, I said, well, you know, here's the thing. You do qualify for free Part A because of your husband's work history. However, if you're in the socialsecurity.gov website, if you're qualifying because of your spouse, it says that you have to call and make an appointment at your Social Security office. You cannot do it online or over the phone because they have to verify a few things. So what I told them was this. First of all, I told her to contact her bookkeeper to make sure that she started withholding her quarterly FICA taxes so that she would eventually get 40 quarters based on her own work history. Number two, I advised them that they needed to make an appointment at the local Social Security office. And she says, but I called the toll-free number and I'm on hold for a couple of hours. And I said, well, watch this. And I had the number for the local Social Security office, not the toll-free number. And I called it, and instead of being on hold for a couple of hours, we were only on hold for 5 minutes and got the gentleman. Now, we tried to make an appointment, but he says, we don't take appointments at this office, you just come in. So again, I verified with him that they need to come in right at 9 o'clock when the office opens so that they would only have a short period of time to wait, and the person that could help them would be there. Very important for you to have credibility with the person that you're working with so that they believe you about having to be there early in the morning. And so the next thing that I advised them was to go first thing the next morning so that they could get in there. Sure enough, and I asked them to contact me the next day after they did so. She did. She texted me to let me know that they had gone on time in the morning, that they had waited, but it was only 30 minutes that they had to wait, and that they were able to get her Medicare Part A applied for free of charge through her husband's work history. All of these things are subjects that Neil and I talk about in training, that we talk about sometimes on the Friday morning coffee chats. And it's important for you to know that these things really do work. But helping your client to understand how the process works and how they have to navigate things is equally important. So please, if you have the chance, attend our trainings, the webinars that we do with Berwick, the Friday morning coffee chats, the in-person trainings as we have them. All of these trainings can bring these little tidbits together in a nice little nutshell. But I wanted to review this with you guys again to show you that what we do train you absolutely works. And we use this regularly when we have these opportunities. Now, I wanted to share that with everybody, Neil, because it's a real life situation that just very calmly I was able to help them with. And they were a lot more relieved when I finished with them earlier this week. Now, switching gears, I'd also like to remind you all that next month, February, I'm doing a Berwick training on duals. Now, this will be national training for Berwick, which means I'll be talking about Medicaid and Medi-Cal and how it works in general. But you know, there's always state-specific things, right? So I am going to be doing a special live in-person training for AMA agents because Neil has asked me. And you know, when Neil asks me something, he's my top agency, I'm going to always take him up on it. So we will be doing a live training in February, in addition to the one that is a webinar for Berwick. I encourage you to attend the live one if you can. That would be very, very important because it will be specific for your state. Now, that being said, I'm going to have one on February 22nd in Las Vegas. We are going to just double check the venue because in addition to the training for duals there in Nevada, I am also going to have a special guest in Anthem that is going to attend, and they're going to do a mixer afterwards. So keep that date, February 22nd, in mind, pencil that in. We'll get you the time and the location confirmed. I was hoping to have it done before today, but we'll get you the time and location. So in Las Vegas, February 22nd, please save the date for your duals training live. In addition to that, our California friends, I will be doing a live duals training in Northern California in San Jose or Fremont. I know that a lot of people liked the location for the Berwick Bonanza that we did at Dave & Buster's meetings room. So I'm going to do it again at Dave & Buster's in Fremont, which is the San Jose area, obviously, as well. In Southern California, we're going to be doing this in Ventura County. We'll also be doing LA County and out in the Inland Empire. And of course, down in San Diego for our San Diego friends. So keep your eyes open. We'll be sending out these dates, times next week. This is for AMA agents specifically because Neil asked me to do that live in-person training for you all for duals because this is a very important subject since you do have year-round business that you can write for the duals. In addition to that, if you're in Las Vegas and you don't have an Anthem contract, you need one. You need an Anthem contract because they have a really good dual special needs plan in Las Vegas. So if you're in Las Vegas or you do business in Las Vegas and you don't have an Anthem contract, please contact Lisa at AMA for that contract. And you can email her, lisa@coveredama.com, or you can call her at 818-403-9376. Neil, do we have any questions out there?
We have a couple, yes, indeed. So I know you've got to jump off for your next meeting soon. So quick couple of questions. Can a divorcee claim their ex-spouse Part A? If so, is it predicted on a couple having been married for at least 10 years prior to the divorce?
Very good question. So actually, you only have to be married for a year, 1 year. And you don't get their Part A, quote, end quote, but you can qualify based on their work history. But you only have to be married for at least 1 full year.
Right. The spouse just has to have worked for those 10 years, right?
That is correct.
Oh, or the ex-spouse, sorry. Next question. I need to confirm that a full scope Medi-Cal eligible cannot be eligible for free Part A.
Well, that's not the issue. The issue is how many quarter hours that they've worked in their lifetime. So paying into FICA taxes. So it's just whether or not their Medicaid will pay for Medicare Part A if they don't qualify for free Part A. So you have to work at least 10 years or 40 quarters paying into FICA taxes. If you're self-employed, you're working, but you're not paying into FICA taxes like this lady was, you're not getting the credit for it. for your Social Security and your Medicare. So it's the FICA tax is being paid for 40 quarters or 10 years that gets you free Part A. The Medicaid or Medi-Cal, depending on the state that you live in, will pay for Medicare Part B's premium, but not Part A. If you don't qualify for free Part A and you have full scope Medi-Cal, then you probably would qualify for the Medicare Savings Program QMB status, Qualified Medicare Beneficiary Status, and that will pay for your Medicare Part A. Medicaid will not, but the QMB program through the Medicare Savings Program will. And we did a training on that not too long ago. But again, if you would, come to our duals training, I'll be reviewing that again for you guys.
Wonderful. Great. Last question. So don't forget, we're going to get those dates out to you. As Judy mentioned, she is made herself available to do a live in-person training over the next month or so in a number of locations. And we're hoping to do a couple of mixes as well. So we'll get those out to you. The one date we do have available, I think, is the 22nd of,
yes.
Is it January or February? January.
February.
February for the Las Vegas mixer and duals training. We'll get a list out to you next week. And Judy, thank you so much for coming on today. I know you've got another meeting that you're waiting to go into, so we appreciate you coming on the call today. And thank you for your words of wisdom.
My pleasure, everybody.
Wonderful, wonderful, wonderful. Okay, let's carry on, folks. Oh dear, I zoomed over a couple here. Let's carry on for our carrier updates. You may have seen some of these. Don't forget, these are taken from emails that we get sent from our carrier partners every single week. We just want to go through some of the most important stuff for you. As you've probably seen from Intermountain Health, they were voted best doctor in their Best of Pahrump Awards. And they had an open house yesterday, last night. So some of you may have gone to that. I wasn't able to. I had a prior engagement. That was actually yesterday. They had an open house at their new North Decatur clinic as well. Hopefully you went to that. Select Health, so talking about their grocery benefit, how to utilize it, etc. They have now the MasterCard logo on the Select Health prepaid card. Don't forget, OTC or healthy foods or healthy grocery can be used to purchase things like fresh fruits, vegetables, breads, grains, proteins, dairy, snacks, pantry essentials, and beverages as well. Non-food pet items, junk food, alcohol and tobacco are not covered. Of course, brand new dental directory for Select Health as well, which has been updated. Of course, whether you got a HMO, PPO, or special needs plan, you got the same dental directory. So make sure you're utilizing that. It's all available online for you as well. As you can see here, some other training. This is a virtual training from United Healthcare, February the 1st, 10 to 11:30. And of course, you can actually go into this Zoom here, and you got the meeting ID passcode here as well. If you are an agent in Nevada, you should have been sent this already. WellCare, as you know, do a ton of trainings every single week. As you can see, next week, they are doing Let's Talk Leads, and then CSNP and DSNP deep dive. And then they're going into their website and Ascend review the week after as well. So all of the stuff we've been talking about, that's what some of these carriers want to help you and support your training with as well. Okay, California. What's going on in California? Aetna, for example, have a home health program or a healthy home visit program, which is available to all Medicare members here as well. Lots of opportunities to have somebody come around to your home and participate in the Healthy Home program. And again, they're going to do some basic checks on you or your clients, and you don't have to leave the comfort of your home. And again, this talks about what happens after an appointment and some other common frequently asked questions. So some of these additional benefits you may have missed by some of your carriers. This is just something that Aetna is offering this year. It's called the Healthy Home Visit as well. And of course, they have mailed every PCP a summary of those visits as well. This is an opportunity for somebody that just wants a regular visit, can actually have that done in the comfort of their home. Okay, some other carrier updates here in Northern California. Next week or so, we have a Northern California broker training, and they're going to talk about DSNP and also some of those durable medical equipment for door members, medical supplies, etc., DME, and also there's going to be a guest presentation as well from Shield Healthcare. That is on Tuesday, the 23rd of January at 10 a.m. So please make sure you're available to go to that training. Okay, some other opportunities as well from Anthem, supporting clients and their prospects during OEP. Just talks about the rules of OEP, retention opportunities, really some of the stuff that I spoke about earlier on today. Anthem 4-door aligned DSNP is now available. This is an aligned plan, so it means that for those doors that have Anthem for their Medi-Cal, as well as their Medicare, yes, their Medi-Cal is not fee for service in certain counties, so this will be Medi-Cal aligned plan, and this will be where both the Medi-Cal and their Medicare dual plan is aligned through Anthem. So these plans are available for you to utilize, and it features $4,000 of dental. This really just talks about those aligned plans. What is a coordinated plan or an aligned plan? And as I mentioned, it's really making sure that both their Medi-Cal plan or Medicaid plan and their Medicare Advantage plan is both with Anthem. Okay, let's carry on. This is Blue Shield of California. They've increased incentive. Their HRA is now $100 for their health risk assessment, and it's available on all DSNP products. It's available for their EAE plan, their Total Dual, the Inspire DSNP plan, and yeah, any dual eligible plan it is available for. Also wanted to let you know that not just Blue Shield, but most of the carriers have updated their commission schedule. A lot of you ask me, when are we going to get paid this? When are we going to get paid that? Look at your commission schedule. I've just been notified as well by Scan that they're going to be paying you for AEP by the 17th of January. So that will be early next week. Also helping your clients with their 2024 plans. I think we covered this already. So this is kind of going over what I spoke about, making sure you offer those clients how to use their plan, how to utilize their benefits, that type of thing is a great way to engage those clients. And they've got a lot of in-person coffee and chat coming up with Broker Manager. As you can see in many of the different counties, they've got that going on as well throughout Orange County, San Diego, up into Northern California to Sacramento, and across Riverside, San Bernardino, San Mateo, and down into LA as well. They're also doing a ton of product training, so please make sure you're aware of this. Again, across all of the state. And again, you can see some additional training. So as you can see here, just from Blue Shield, the same as a lot of our carriers, they are putting on a ton of different training opportunities for you as well. As is brand new day, they're doing some lunch and learn. RSVPs are required. They're going to offer you lunch here. So if you want to go to lunch in Stockton at the Mediterranean Bistro, that was a couple of days ago. But next week at the Black Bear Diner in Milpitas. So again, if you're in San Jose or you work in San Jose, nice opportunity. Go and learn more about Brand New Day and get lunch. They're doing a virtual session as well next week. So you've got a couple of different dates as well. Don't forget Brand New Day and Central Health are still offering that $100 for HRAs, with the exception of their CSNP plans, and they're going to be paid at $200. Okay, moving on, Molina. So Molina, California D-SNP is now available on their online app. So electronic health risk assessment you can do through their iCaro, which is their online enrollment platform as well. And again, this is just talking about the enrollment opportunities during open enrollment. Really just talks about what is open enrollment. A question came in from somebody about it. Can I move a drug plan from one to another? Not using OEP. OEP is purely for the Medicare Advantage open enrollment period. Okay, what else we got with WellCare here? Lots of online and in-person trainings coming up here, folks. So you can read this as well as I can. Some of this you should have already received in the area you live. And then a few updates for everybody. If you have a look at United Healthcare, obviously Medicare Supplement, United Healthcare is the biggest Medicare supplement provider, very competitive in a lot of areas. They have their brand new Medicare Supplement, Medicare Puzzle campaign. With the regional Medicare, of course, your clients may not have all the health coverage they need. So the Medicare Advantage, the Medicare Supplement, AARP Medicare Puzzle campaign is brand new on the toolkit. And again, it's going to help your clients learn about Medicare Supplement from United Healthcare and help them understand the out-of-pocket costs that they will have in line with that as well. It's available through Jarvis, and again, just search puzzle and you can see all of these wonderful things that you can send out, include in flyers, letters, and postcards as well. Okay, moving on here, just with alignment, the CMS final rule for 2024, MA plans are to annually notify members in writing of their ability to opt out of phone calls. So again, this just goes through that policy that came in October, and alignment just want to be upfront and clear on some of those policies and what they're doing to make sure they're following this process. Okay, more trainings from United Healthcare here. This is trainings through Jarvis. So this is some of those national trainings. Don't forget, United Healthcare reaches out to you individually for your local broker manager, but also they reach out through Jarvis. So if you go through Jarvis Knowledge Center, this is all available for you. And again, all of the stuff that's through the Learning Lab on Jarvis is all training that generally is virtual. And of course, they don't leave any stone unturned. And also they want to talk about elite status. So don't forget, just 25 eligible applications per year. You become an elite agent. You get access to exclusive marketing. Non-resident state appointment fees are paid by United Healthcare. Earn extra cash and a trip from United Healthcare with their 820H program. That is their program authorized to offer. And for the new plan year, the CSNP and OTC and healthy food banner grab people's attention at meetings with the brand new healthy food banner as well. All of that is open for you if you are at elite status. And of course, there are materials available for those folks that are new to Medicare. You can always go into Jarvis Agent Toolkit and then search new to Medicare, and that will come up. SEP news, the Federal Emergency Management Agency, FEMA, may have declared a weather-related emergency for affected areas and dates. Please visit Jarvis, and it lists everything that's on there and is covered through any FEMA emergency as well. Okay, moving on now to WellCare. They are suspending enrollments and marketing for Medicare Advantage plans in Florida and North Carolina. So if you have anybody on contract number H5199 or H7175 in North Carolina, these two contracts will not be renewed for next year. They will end at the end of this year. They can stay on the plan for the remainder of 2024. But of course, I would contact your clients, because if you don't, somebody else will. So if you have anybody on these plans, please reach out to these folks as well. Centene Workbench Book of Business. Don't forget, you've got all of that data available for you through your single sign-on. And again, they are going through a transition, a joint venture owned by Ascension, and Centene has become their WellCare Complete, a product purely from WellCare. WellCare Complete benefit plans will continue to offer access to the network of doctors, etc., etc. That is it from me. We are about 3 minutes away from the end of the call. Lots of information today. Hopefully you found today useful. And again, we are here every Friday. A couple of you are asking about reimbursements for AHIP. Please reach out to that carrier. There's normally a carrier form to receive that reimbursement for AHIP. If you're getting a reimbursement, marketing reimbursement due to, for example, enrollments, that is done automatically by that carrier. But again, looking for any reimbursements for AHIP, normally as a form to fill out where you have to provide those clients. So please reach out to your local broker manager. Have a wonderful weekend, everybody. I look forward to speaking to you next week. Monday is a federal holiday. Don't forget, banks are closed. So if you're expecting commissions in Monday, they may be paid on Tuesday instead for any of our carrier partners as well. So please make sure you remember that. And we will be back next Friday. And next week, I will be traveling back to Southern California, visiting Terry and her team in San Diego for a couple of days. And then I think I'm in the Inland Empire as well. So if you're in that area and want to meet up, or you've got some questions, reach out. I'm available. And I will be in our office in Las Vegas a bit later on today. Thank you so much. Speak to you all soon.